Good morning.
Good morning.
Good morning. Can you guys turn your cameras on, please? Thank you. Samaya, Kendra, could you guys turn your cameras on? Hey. Hey there, big guy.
Okay, one moment. I wasn't fit to be on camera, so hold on.
Sure. Hi, Samaya.
Hi, sorry about that. I have to hook up a webcam to my laptop. My camera doesn't work on my laptop for some reason.
Okay.
But I heard what you said.
Oh, okay. And make sure you guys put your name and your professor in the chat so that I can send, when I send the recording, I can send the attendance. Hi, Kendra.
Hello.
How are you?
Good, how are you?
Good, good. Thank you.
We have to leave our cameras on
Yeah. Well, I mean,
because I'm
yeah,
trying to multitask right now.
you're going to be able to, okay. Good morning, everybody.
Good morning.
I'm glad you could make it. Make sure everybody puts their name and their professor in the chat so that we can take attendance. And when I send the recording, I'll also send the attendance. So this is the second, hey, Sade. This is the, pardon me, this is the second of two reviews. Professor Morton Ford did one on Monday, and that recording should have been sent out. I know my students have it. And so I will be sending this recording out to my other two teammates to post in their announcements. So you'll have two recordings. And then Professor Kershaw will do hers on Sunday evening. And that's in your the handout that I attached to the announcement about reviews. Okay, so she does hers on Sunday evenings. So as soon as she sends me that recording Sunday evening, I'll get that posted as well, or we all should get that posted. Okay. Sade, are you there? Okay. Anybody have any questions about exam 2? Everybody see the study guide? Guys had a chance to look at the study guide? Okay. That's a good start, the study guide. The study guide is a combination of your readings, our lectures, the weekly notes that you get. Okay, so at this point, the topics and concepts on the study guide should be familiar to you. Okay, it's the same guidelines, download the exam before you come to class. Some some study tips that I have for you. Let's see, number one, be careful about changing your answers. Okay, make sure that you can justify in your own mind why that answer needs to be changed. Pretty solid justification. Not like, oh, I think I remember reading this in my notes, or I think I remember this. That's not solid justification. Okay, so be careful about changing your answers. Maybe try and read the question and without looking at the answers, come up with your own answer first, and then read the answers and see if anything matches. Okay, because if it does, it's a good indication it's probably the right answer. So try and come up with your own answer by yourself first. only read the question a couple of times. Okay. If you don't get it after a couple of times, don't waste a lot of time on one single question. It's only one question. Make the best choice you can and move on. Okay. What else? Please read the questions carefully. Many questions have words or phrases in them that will lead you to the answer, right? What is the greatest? What is the first? What is the last? What is the most appropriate? And those, what is the most appropriate answer? All the answers might seem like they're right, but and that's a clue. If all the answers seem like they're right and it's not a select all that apply, go back and read the question, because it probably says what is the most important. Okay, they may be all important, but what is the most? So when I do my exam reviews, that is the biggest hurdle that I work on with students, is making sure you pull out the important words and phrases in a question. Okay, there's a lot of those. Okay. Make sure you can recognize a positively asked question and a negatively asked question. What I mean by this is, here's an example. The nurse is educating the family on good nutrition. What might she say that requires further education? Meaning, what does she say that was incorrect? Okay. A lot of students get hung up on those questions as well. So make sure you can identify a negatively asked question. So you're kind of looking for the wrong answer, right? The wrong answer, which is actually the correct answer, right? So let's give another example. Or somebody give me an example. What would be a negatively asked question? You guys give me an example. Can you think of one? The nurse is working with a family that kids with asthma live in a smoking house. The ultimate goal is to make it a non-smoking house. What might the parent say to you as you're interviewing her that might require further education? So maybe the mother or the parent says something like, "Oh, don't worry, I use e-cigarettes now." That would require further education, right? So what does she say that's concerning, that's a red flag, that would require further education? Does that make sense? Those are negatively asked questions. With select all that apply, don't be afraid to select all. Okay, when I meet with students and they miss select all that apply questions, they picked 4 out of the 5 answers. And a common theme I get is, "Oh, I didn't think you could pick all of them." Absolutely, you can. Okay, so don't be afraid to select all that apply. Select all in a select all that apply question. Okay, when you're reading, say, a long question, after you read it, maybe summarize the question into a shorter version that you can understand. Meaning, eliminate the information in the question that may not have anything to do with the answer. Does that make sense? Reword the question in your own mind so you understand it better. So those are my tips. Does anybody else have any tips that they use that you want to share with the group? What are your test taking strategies that you use? Sade, what do you use?
Hell, I just review for like 2, 3 times.
Review like your study guide?
Yeah, study guide and everything.
Okay.
Yeah, I usually, if I don't know anything that the question is asking. I do pick out what I do know from the question and try to answer that way.
Perfect. That's a great tip. Anybody else? And again, if you have a good understanding of the study guide is a summary of what we've covered. So if you have a good understanding of the study guide, you'll do fine. You'll do well on the exam. You know, if there are things on the study guide, and we're going to go through that in a minute, if there are things on the study guide that you don't feel like you have a understanding of, then go back to the week it was in, go back to that reading, review the reading in the book on that section, and go back and review the notes, the weekly notes. Okay. And after you've prepared, after you feel like you've adequately prepared for the exam, if there's still some concepts that you're not understanding, please reach out to your instructor prior to the exam and set up a meeting. We're happy to do that. Okay, but you have to do your due diligence as well and prepare the best you can for the exam. And after all your preparation, you're still not getting something or a few things, reach out to your instructor, please. Okay. So I'm going to share my screen here. Make sure you all have your name in the chat and your professor. Okay. I'm going to share my screen and we're going to pull up the study guide. Okay. So this looks similar to the first one. Okay. I've tried to summarize for you the concepts that we're going to be covering. Okay. And this is broken out into weeks 4, 5, and 6. Okay. So this week, so my class comes up after this review. So this week we're covering occupational health, environmental health, barriers to learning, and reinforcing health education. So if you're a Friday student, you haven't had this covered yet. So you're going to get a little taste of it here in the review. Okay, this is our week 4 concepts. I should probably make it easier. Week 4. Week 5. Does that make it easier? Week 6. Okay, so these are the concepts that were covered in each of the weeks. Okay, so this is what we're going to cover today. Okay, and I'm not going to read every part of the study guide. I just want to show you how it's organized. And when you read, when you read each bullet in the study guide, let's think of what kind of question might be asked about that. That's the most important thing. As you read this, and I don't want to jump ahead. Let me go back to the readings real quick. So there's your concepts, and then here's your readings. Okay, so I've reviewed all that. I've restated all of that for you. Okay, so if you don't have a good understanding of hospice and palliative care from your study guide, and jump here to week 5, and let's see where it was. Okay, your Canvas course. So you had a teaching sheet in your module about hospice and palliative care. Pardon me, and I believe that was a video. Okay. So same kind of exam, 50 questions, multiple choice, select all that apply, and some math problems. Same limit, 75 minutes unless you have accommodations. Okay. Math, I've sent out math resources to you early in the term. So if you struggle with math, please go back and refer to those. There are nice little cheat sheets on how to set up formulas and how to work math problems. Okay. So remember safety first, remember your ABCs, remember your priority questions. What words might we be looking at? First, last, greatest, least, most. What else? In other words, words that may lead you to you have to think about the question differently. Okay, and then obviously remember ADPI, your nursing process. ADPI is applied in every part of nursing. In this class, we're learning how to apply our ADPI into the community setting. Okay, so you should be reviewing the study guide, your notes, your readings. And remember, if you have, say, chapter 8, like this week, we have chapter 6, which is really chapter 8. So I need to change that. Okay, so where it says 6, it's 8. I think I put that in the announcement, didn't I? Or did I correct it before I got it up there? So it's chapter 8 and chapter 9. Okay, so when you're asked to read about communication in the nurse-patient relationship, remember, there's only a few pages. Okay, you don't have to go back and read all of chapter 8. It doesn't apply. Only pages 115 through 117 and 121. Now, chapter 9 is the whole chapter, right? And you know that when you see Canvas course, that's a teaching sheet in your module. Everybody knows that by now, right? Yes? Okay. So, what do we need to know for the next exam? Well, I have all the topics, concepts highlighted in yellow. Okay, what do we need to know about we need to know about the American Nurses Association. What do we need to know? Okay, so let's just read this and think of what kind of question might be asked. The American Nurses Association has formulated general standards and guidelines for nursing practice. They are broad and general in nature and apply across the nation. The standards of care define professional practice. What might you get asked? Maybe something like, there's 3 different parts to this. What are the standards of care and from the ANA? What would be the answer? Or what are the standards of care defined? What would the answer be? It's right in front of you. It's right here.
Professional practice.
Professional practice.
Professional practice. Okay. What about if you're asked, what is the purpose of the American Nurses Association? What's the right answer? Formulate general standards and guidelines for nursing practice. Okay. What do we want to know about vulnerable populations? Let's go to the next one. Vulnerable populations often have poor health outcomes compared to other people in terms of morbidity or mortality. Okay, here's some information about vulnerable populations. These groups have high prevalence of chronic diseases, such as hypertension, communicable diseases, TB, hepatitis B, STDs. What if you get asked a question? Vulnerable populations have an incident. What are vulnerable populations most at risk for? Select all that apply. Here you go. Here's your answer. Chronic illnesses, hypertension, communicable diseases, TB, Hep B, STDs, upper respiratory tract infections. Right? Okay, here's another part of it. They also have higher mortality rates than general population. Maybe a question like, why do vulnerable populations have a higher mortality rate? Select all that apply or select one answer. Okay, here's the information. They have barriers such as poor living conditions, diet, health status, crime and violence, including domestic violence. Okay. Let's talk about pregnant adolescents. I think there's 4 bullets here. So as you read through these, we can gather what we're expecting you to know. So let's do the first bullet. Pregnant adolescents, we know, are much more likely to engage in sexual activity without birth control. Right? They also don't know about reproductive rights or services. They're present oriented. They don't think about future consequences. They're most likely already caught up in the poverty cycle. High-risk pregnancies, they're high-risk pregnancies with risks of preeclampsia, low birth weight, prematurity. Okay, so what might we get asked in here? What are the risks? What are the high risks for pregnant adolescents? Well, number one, sexual activity. Number two, they're present oriented. Okay. Here's a bullet about pregnant homeless teens. Okay. They have several challenges. What are they? Here they all are right here. Okay. That's how I need you to break down each of these bullets. What information are we providing you? Okay, here we're providing you several challenges for pregnant homeless teens. What are their several challenges? Higher rates of STDs, higher incidence of addiction to drugs, poor nutritional status, and higher incidence of birth outcomes. There's 4 answers. Okay. Next bullet is what does a postpartum visit look like with a teenage mother? So it tells you right here, the primary goal will be to assess how much the mother understands about the needs of the infant and their development. Okay. And then such knowledge helps avoid unrealistic expectations and frustrations, which could lead to child abuse. Primary goal, postpartum visit would be to assess knowledge regarding normal growth and development. That should be up here. I'm just moving this here. Okay. Well, the last bullet is adolescent pregnancy outside of marriage. Okay. Why is that an issue? And why is it happening? Low self-esteem, fears of inadequacy, desperation to escape from an abusive family. And it talks about communication. The most therapeutic communication technique is one that we restate and repeat their main thought and then let them open up and discuss it. Okay. Then we have a section on mental illness, anxiety, mood, and eating disorders. Okay. We know that this group has a high risk for homelessness, substance abuse, victim and or perpetrator of crime. And since this section includes eating disorders, we need to know about general anxiety disorder. Okay, the next one is we need to know about phobia. That addresses phobia. This next bullet addresses OCD. Next one is PTSD. And then the last one that's addressed is bipolar. So you need to know about each of these. General anxiety disorder, phobia, OCD. It's all each are broken out into a separate bullet, PTSD and then bipolar. And in bipolar, it talks about lithium. We need to know what to teach if one of our clients are taking lithium. And then the last bullet is some examples of primary, secondary, and tertiary when dealing with this client, this type of client with a mental illness or mood or anxiety. Okay. The next section is substance abuse. So I've highlighted a few things that we need to know about. You need to know about alcoholism. And again, if you understand what's said here and you feel comfortable, then there's no need to go back. But if something doesn't make sense, go back and read that section or read your notes. Okay? So we talk about alcoholism, we talk about energy drinks, tobacco, and e-cigarettes, and then cocaine, amphetamines, methamphetamines. So these are the substances in this section. Those are the substances I want you to know about. And as you read something, let's see, cocaine, amphetamine, methamphetamine, stimulants, they're associated with cardiovascular complications. Somebody who abuses this may exhibit high body temp, high heart rate, high blood pressure, requires emergency. What kind of question might you get asked?
What are the
Maybe
complications?
it's
Cocaine and then acetaminophen.
Right, you're taking care of a patient that you suspect abuse. They have a high body temp, high heart rate, high blood pressure. What substance might they be abusing? Tobacco, e-cigarettes, cocaine. Okay, and cocaine is your correct answer. So think of scenarios that might be asked. Okay, and death and dying. Okay, the word priority. Pain control is a priority. So if you get asked, what is the priority of palliative care? What's the answer?
Pain control and
Pain
comfort.
control. All right, controlling GI or respiratory distress, providing comfort. These are all goals of the dying patient. Pain control, comfort, maintaining the client's dignity and self-esteem. Right? Therapeutic complications with family members. Listen for opportunities to learn more to identify an issue. Right, you guys already know about this, asking open-ended questions and kind of repeating what they're saying, and then let them talk about it more. Can you share your concerns? Can we talk about this together? What is weighing on your mind? What do you know about what's going on? And I do want you to review the stages of grief. Okay, so if you don't know what the stages of grief, you need to go back to your reading right here, chapter 15, grief, end of life care. Okay, so your stages of grief are in chapter 15. Okay. Faith, what do we want to know about the faith community nurse? Well, you need to understand the differences between religiosity and spirituality, and we covered that in class. So if you can't articulate that now, you're going to have to go back to, where are we going back to? Where's our nurse? Okay, when did we do,
Would it be week 5?
Week 5.
oh,
Chapter
it's
4.
it's going to be in cultural and spiritual aspects of patient care. Okay. You guys are smart. Here's some examples of what the faith community nurse does from a primary, secondary, and tertiary level. Okay. Actually, here's kind of this second bullet is kind of your answer to the first bullet, right? We know that religiosity incorporates religious traditions. Okay, so you're talking about one religion. You're part of a congregation, whether it's a church, a mosque, a temple. You're part of one religion. But if you're thinking spirituality, what is spirituality? The big picture, right? The full spectrum of how you view God and how you view. What is your view of spirituality overall? And that's a difference. Religiosity focuses on one religion. Spirituality looks at the big picture. What do we need to know about ethics? Well, the first step in the ethical decision making is to identify the ethical issues that are faced. So what if you get a question that says, what's the first step in ethical decision making? What's the answer? Right here. What? Go ahead.
Identify, what is it? Identify the ethical issues that are faced.
Right? And then you obtain all the relevant facts. You consider appropriate approaches, such as utilitarianism or principalism, which are ethical theories, make a decision, implement. What does all this sound like? Is this ADPI with regards to ethics?
Yeah.
Identify the issue, obtain the facts. What's our plan? What's the approach? Make a decision to implement it, and then evaluate the outcome. There's a perfect scenario of how ADPI is applied to our different topics. Okay. Purposes of an ethics committee. You might get a question about what does an ethics committee, what's their goal? Okay, what do they do? Okay, well, they process ethical dilemmas, they provide education, and they provide policy recommendations. Here's your ethical principles, your beneficence, which is do good. Autonomy, respecting the client's rights. Non-malfeasance. Okay. So I'm just trying to highlight where each of these are. Okay, so you've got autonomy, non-malfeasance, beneficence, and distributive justice. There's your four theories right there. So you need to know what you need to know a little bit about each of the theories. And knowing what's here is good. Okay? So you have your ethical principles, which we just did, and then you have your ethical theories. Okay? There's four of them you need to know. Principalism. Utilitarianism focuses on the outcome. Okay, principalism really incorporates all of these principles: autonomy, beneficence, non-malfeasance, and distributive justice. Okay, utilitarianism is the outcome. Then deontology is the righteousness of actions. Okay, and then you have the feminist ethical theory. Okay. Ethical duty of a nurse is to provide high quality, unbiased nursing care to every patient assigned to you. If you cannot accomplish that, you need to find another nurse for the client and then walk away. Right? So if your values, beliefs prevent you from caring for a patient, you can't just abandon the patient. You need to communicate that before you walk away. Make sure somebody else is covering that client. And then please review some advocacy examples. With regards to, so go back to your ethics chapter. If you can't articulate what examples of advocacy are when it comes to ethics, you're going to need to go back and read your, hang on, it's in week 5. Right here, chapter 3. And there's only a couple of pages, 44 to 46. Okay. So go back and read about advocacy. Okay. And education. How are we educating our clients? Okay. This first bullet goes through the whole ADPI. What we have to assess the barriers. What barriers to, what do they know? What do they know? What is most important? Is there a language barrier? Right? Know the 3 domains of learning. Cognitive, affective, psychomotor. Cognitive, if you remember, is the thinking. Cognitive, we're thinking through things. If that's the way we're learning. Well, we all kind of learn in all 3 of these ways, but cognitive is your thinking. Affective is your feeling. How are you feeling about it? A lot of people learn in the affective way. And then psychomotor is the doing, the hands-on. That's the teach back. Okay. Here's a pretty big statement. One of the most important learner-related barriers are low literacy. So what if you're asked a priority question about this? When it comes to patient education, what is the most important barrier to education? Okay, there's lots of barriers, but they're asking what is the most? So what would your answer be? I mean, all the answers may seem fine. Language barriers, transportation, it may be all fine, but if the question asks what is the most important barrier, is low literacy. Okay, and this bullet explains about low literacy. So what do you do with a client who is aphasic and has difficulty understanding? That's what this is about. So if you're asked a question about a client that's aphasic, what are some teaching strategies? They're all in here. And then this next one talks about the hearing impaired client. How do you educate a hearing impaired client? Okay. And then another bullet about therapeutic communication. Okay, so focusing and verbalizing the implied concern is a therapeutic response when speaking with a client because it assists the client to clarify thinking and maybe to re-examine what they're really trying to say. And then we should all know this, discharge planning. When does it start? When does discharge planning start?
On admission.
There's your exactly. Begins at the time of admission, right? And then these are the areas we're gonna cover this later. But what's occupational health?
Like where you work,
Yeah.
which environment do you work?
Yep. Occupational health is all about health promotion and safety in the workplace. Okay. So an occupational nurse will see various injuries and diseases that people can either acquire from employment or that they have coming into employment. Occupational nurse plays a really significant role in the healthcare team in the workplace. Okay, here's some primary, secondary, and tertiary interventions for her. Okay, she sees various diseases and injuries. And we know that no workplace is completely risk-free. right? Every single industry has risks for hazards. Okay. Everybody made a different set of risks and different set of needs, but there's absolutely no work industry or no work place that is completely free of risks. Okay. Cultural competency and diversity. Cultural competency and cultural diversity. This is one of my big topics. Okay, because we have to be culturally competent to care for our clients. Right? Cultural competence requires that we approach clients as if they're unique, right? And to learn about them, we have to gather information about their beliefs and expectations. How do we do that? We ask them, right? We don't treat every client the same way, right? Nor do we treat them the way we expect to be treated because our cultures may be extremely different. Right? And the last thing with cultural competencies, we don't just learn common beliefs about the most common minorities. We learn about cultures of all kinds, not just minorities. Does that make sense? So this bullet's given you what cultural competence, what does it require? Several things. Number one, that we approach each client as they're unique. Okay. Number one. Number two, we gather data on their beliefs and expectations. Number three, we do not treat every client the same, nor do we treat them as the way we want to be treated, as our cultures may vastly be different. And then we don't just learn the common beliefs of the common minorities. Okay. Cultural competent care requires that we have to have an understanding of our own culture and any biases or stereotypes we might have. Okay, we can't make any assumptions. We can't place our culture above anybody else's. Okay, and I know for all of you out there working cultural competence, I know you're working with lots of different clients. You've already faced cultural diversity. And that's going to be throughout your entire professional career. Okay, and then this is about some cultures this is about how they see things. Are they future oriented, past oriented, present oriented? And it goes through what each of these are. So you might get a question, you might get a scenario, and then you're asked to say, are they thinking in the past? Are they thinking in the present? Are they thinking in the future? So that's what this is about. This next bullet is about caring for LGBT families. We have an ethical obligation to provide culturally competent care to the LGBT families. Okay, so this goes through the process with regards to cultural diversity of caring for LGBT families. Okay, provide a safe environment for patients to discuss their sexual orientation, understanding your own feelings about same-sex marriage, family, law, right? But when you're caring for LGBT, it's important to recognize your own beliefs. And then this last bullet is about CDC. You need to know what CDC does because public health, community health is directed by the CDC. So this gives you several things that the CDC does. So if you get asked, what types of services does the CDC provide? Okay, well, number one, provide recommendations on the screening and prevention of STDs, yearly screening for HIV, syphilis, gonorrhea, chlamydia. Okay, so you need to know what the CDC's recommendations are for STDs. This is what their recommendations are. And then growth and development. Okay, there's 2 chapters up here for growth and development. Okay, there is right here, chapter 19 and chapter 20. We talk about the school-age kid and the adolescent. Okay. So here's some information. Here's some statistics, guidelines about what happens if you're 7 to 12 years old. What are you doing? Well, they begin to move toward receiving support from their peers and friends, trying to get away from their parents. Right? They also develop social interests that reflect their own developing personality instead of those of their parents. They become more organized with direction and play activities, and so on. Okay, when we're looking at Erickson's psychological stage of identity, where does the adolescent fit in? So you need to review Erickson's psychological stages with these two groups. Okay, so the first two groups is first three focused on adolescence. Okay, and then I put this PACE, I want to know about this PACE model. Okay, so for adolescents who are prone to mood swings as they try to adjust to many physical, psychological changes occurring in their lives, they may be presently feeling overwhelming. Okay, the PACE interview assists them in distinguishing 4 different things. Distinguishing the drug-free adolescent, and maybe if the interview maybe gives you indication if they may be experimenting with drugs. Okay, so, and then that's the first one, the P. The A is alcohol and automobiles. Are you questioning about, are they using alcohol? What's their driving record like? C is your cigarettes, discuss your cigarettes. E is education. What do they think about their performance in school? Okay, so we know that if 2 or more of the PACE letters are problem areas, right here, after interviewing, if 2 of these are problem areas, so they have, I don't know, trashing their parents, trashing their peers, have an attitude towards marijuana, if they're into alcohol, if they're having driving issues, if they're smoking, right? If they're just kind of blowing off school, what's their attitude towards school? If 2 or more of these letters are problem areas, then the adolescent may be at high risk for drug abuse and require a referral. Okay. So there's your study guide. Questions? Is that helpful to go through it like that?
Yes, it is. Thank you.
You're welcome. Any questions? Just weeks 4, 5, and 6. Okay, so you have everything you need on the study guide as far as your concepts being covered, your readings that you may need to jump back to, and then your notes, you'll have to go back and find them for weeks 4, 5, and 6. And it's good to review all of those.
Are we gonna have the same concept, like we're gonna have a case study and you have to answer the case study?
I don't think there's a case study in exam 2.
Okay.
I don't think there is. No, I don't think there is. Okay. Well, good luck to you guys on exam 2. Again, like if you have a good knowledge and understanding of the study guide, you'll do fine. You really will. Okay.
Thank you, Professor Marvel.
Thank you.
You're welcome. I'll stay on for any questions. Okay, I'm going to stop the recording, but I'll make sure your professors have the recording